Thank you very much for coming here to participate or to attend this extremely significant event. In about 10 minutes, I will present the reasons of the need for novel approaches in the mental health treatment, psychedelics being essential in that. We have heard it many times that mental health is an issue. The total cost of the over 4% of GDP. In Europe, COVID has shaken that and doubled or tripled the prevalence of majority of mental diseases like anxieties and depressions in particular. And the years to come, it hasn't improved. Unfortunately, and this negative trend is continuing. It doesn't only concern or affect adults, but children. This is a recent study. That's the prevalence amongst younger pupils, older, and that's generalized anxiety symptoms, depression symptoms, social self-harm, lack of appetite. All those have the prevalence has doubled or tripled. After COVID, the negative trend continued across the board. Poor mental health, non-specific, applicable to all the dimensions. When all these kids become adults, it'll be more specific. In other words, the disorders they will suffer from. And we should do our utmost to prevent it. Suicidal thoughts are on an increase amongst children. And after COVID, this is a Finnish, by the way, study or trial, but the suicidal attempts have gone up as well in numbers. The situation is truly serious. There are new problems like gender identity issues, gender dysphoria amongst children and adolescents. The trend started as early as 2008, but it has been accelerated in the COVID period. And it naturally is true in this country. This is data from the so-called UZIS Institute of Health Information and Statistics. So what are the reasons behind it? Majority of causes has already been mentioned. I believe it's the digital world which prevails, and the model I'll try to explain is pretty simple, straightforward. Let us imagine that we are sort of beings that are, so to say, thrown into the surrounding world, and there are inferences done by our brain. Processes are inferred, which are pretty understandable or clear. Apart from this direct contact with the surrounding world, with the physical world, like the room here, people around you, the world also represents or is shown through mental representation. That means the pictures of the world that are omnipresent in the digital world. And our brain and our psyche is challenged with finding out what's true and what's merely false representation or whatever. What is the outcome? Growing anxiety, uncertainties, or feelings of uncertainties, and it's then potented by all kinds of crises: global warming, migration, war in the Ukraine and elsewhere, etc. This is in contradiction. This, in other words, it's not reflected by the funds allocated to mental health disorders. 14% of total costs of medical care are represented by mental disorders, while 6% only of total costs is allocated to biomedical research related to psychiatry or psychiatric diseases. Therefore, in 2022, EMA, which is the equivalent of our SUCL, approved 89 new drugs, and not a single one, approved or authorized was designed for psychiatric treatments. So what do we have to do? We have to focus on novel mental health treatments. During our presidency, we have done our utmost to promote this agenda. We organized a couple of meetings in European Parliament, the goal of which was to table this or to underline the need for more funds to the introduction of novel mental health treatments or novel treatments in psychiatry. We should also refer to the Ukrainian perspective. I was lucky enough to be in the Ukraine with our government delegation. It was a kind of fact-finding or reconnaissance mission, which was to identify ways and possibilities that the Czech Republic should opt for to help. And the situation there is truly severe and serious, especially in trauma-related matters, and is really full-scale crisis. Maidan, Kiev, you can see meters or dozens of meters of pictures of casualties or dead soldiers, and the war was not long enough so the Ukrainians can no more place the pictures of those casualties there. So that's a trauma we have to focus on. Trauma in the general population concerns 3.5% of general population, and the PTSD, which is the most serious one, is on an increase, keeps increasing with the traumas related to the war in general population. This represents 3.5 personnel or soldiers, or 25%, and it is both in the occupied territories as well as amongst those displaced or removed simply from the areas of war. So such is the dimension of the issue, and we should be aware of that. Fortunately, though, substances or compounds with psychedelic potential are under trials or studies, and it shows the effectiveness for PTSD. 2 years ago, a major study was published that shows that psychedelic effect of MDMA, simply MDMA-assisted therapy, can not only improve the status or health status of the patients, but also can lead to the no symptoms period. In other words, elimination of all the symptoms whatsoever. Psychedelics are covered by ever more articles and also are the subject of very many trials. It is the mainstream, psychedelics is the mainstream of our era. They have the so-called transdiagnostic action, which means that they have an effect or positive effect can be used for therapy of multiple diseases. Czech Republic should help, essentially, Cyrus says, in the introduction of this novel treatment or therapy. It is only legitimate. Why? Because we have been over 20 years, we have been publishing lots of papers, we have been conducting studies or trials. So now exclusively we focus on clinical trials and clinical research, which means introduction testing of future broad employment. You will hear about that by Dr. Pálenček. We have implemented or introduced the so-called Czech model, which means novel use of psychedelics in treatment treatment. First, what's necessary? Well, first you have to properly define the issue and de-stigmatize psychedelics, since there is still a myth claiming psychedelics to be a addictive drug. Cost-benefit analysis, then we should also know about its effects at the level of molecule on the brain. And we have evidence of psychedelics being helpful and at the same time being, so to say, bearing a certain ethos, like if you have existential distress in people close to death, which is my specialty, or prompt recovery of psychic well-being amongst the veteran of war in Ukraine, which is yet another area we have been addressing. What's also important, to persuade the payers that simply willingness to pay, and also to suggest or offer best practice. The Sion psychedelic clinic is a great example. We have been performing ketamine-assisted therapy. I've got a picture of this number of patients. They were on one dose or multiple dose, and you see the improved anxiety and which persists for the period of 1 to 6 months after the KAT. Obviously, it is sustained with a sustained effect, and that is an argument that I consider essential also for the payers and for the design of the system. We believe we should promptly develop such conditions, legislative conditions, that this could be deployed. We should act similarly to as an agenda setter. And also we should promote the idea that the recovery of mental health or renewal is a part and parcel of the recovery of Ukraine. We should share know-how, offer trainings, courses, funding to them in order to contribute to the improvement of the situation in Ukraine. Thank you very much for your attention.